Good afternoon, everyone. Thank you so much for joining me today. I'm really excited to be here to talk to you today for the seminar Microdoses, Macro Impact. I am Dr. Candace Pierce, and I am not going to talk about anything on this slide because what I really want to talk to you about today is microlearning. But I know that there are probably some people out there who are wondering who I am. So today for microlearning, I want to talk about a way to bring learning and our mobile devices that we already take everywhere we go and how we can really leverage those and what we need with what we already have. And that really led me to the fun title, Microdoses, Macro Impact. And it's a really great way to explain what microlearning is really all about. So today we're going to explore microlearning, mobile learning, and talk about how these two things are transforming continuing education. And I'll be honest, my background is healthcare, so I'm really focused a lot on healthcare professionals, but really any profession that requires continuing education or a student that requires education in general is going to benefit from the use of microlearning. So hopefully you can have your phones handy and you can scan this QR code and go ahead and answer this question. How many minutes do you typically have for learning during a workday? Now, I know a lot of us are balancing a lot of things. We're balancing being, I know for me, a working mom, a wife, I also teach, and then I work for a continuing education company. And so our days are just really, really busy. So what I'm really hoping to see, and what this really confirms, is that we really don't have a lot of time in our workday for extra learning. Now, microlearning involves delivering, and I also wanted to tell you to hold on to that QR code because there should be another one that you're going to be able to go to that you're going to be able to answer the question for. Now, microlearning, it involves delivering educational content in small focused segments. And then we have mobile learning, and that's really just taking those mobile devices that have really now become a part of our wardrobe in just about every way. But that provides flexibility and on-the-go access to these bite-sized modules. Now, when we use these two things together, education in general and our mobile devices, it really offers a way to fit learning into our busy schedules. And you can send out critical clinical updates, in some cases, skill refreshers, and they're accessible anywhere and anytime. And really, it's only limited to two things: our imaginations, or you can call that our creativity, and the capabilities of the platform that you're using and how it pushes out that educational curriculum. Now, I want to look at the current challenges that you have, not only in participating, but also if you're somebody that provides continuing education, what are some of those challenges that you see? And I see competing priorities, that's really big, low attendance, resource issues, scheduling conflicts, relevance. See, all of these really go back to our time constraints. Also, there's information overload and the difficulty of attending lengthy training sessions. And I really want to point out that every single one of these is going to go back to lower engagement. And I saw where people are saying low attendance. It's all about lower engagement, and that also is lower retention rates. So the characteristics of microlearning is bite-sized. The length of the learning module should really only be 3 to 10 minutes. And this short duration ensures that the content is easily digestible and can be completed quickly, even during brief breaks in a busy workday. There was a study that came out in 2017, and it revealed that learners were more likely to complete and engage with content that was under 10 minutes long. And that's really what makes microlearning an ideal format for professionals who have limited time for continuing education. Now, with each module, it should be only focused on a single specific learning objective. And this is what helps learners concentrate on one topic at a time. It's going to reduce the effects of cognitive overload. And we know when we reduce cognitive overload, we increase their ability to retain the information. As an example, maybe you put together some microlearning modules on the proper technique of how to give a medication rather than covering everything about that medication in one session. Or maybe new information came out on how to use a medication, on what it can be used for, or maybe a new side effect came out. So just one focus. And these are really important characteristics because both of these, the duration and the focus, they're going to help make sure information can be absorbed and that it is being absorbed rather than the participant going into that cognitive overload where they get overwhelmed and we don't retain very much of anything. So no more than 3 to 10 minutes with one objective. There are a lot of benefits to microlearning. Flexibility and accessibility is huge because that allows professionals to fit learning into their hectic schedules. It could be during a quick break between consultations. Maybe if it's like a podcast where you're talking, they can listen to it on a commute. Microlearning can be assessed anytime and anywhere when we leverage mobile devices. And this flexibility is going to ensure that learning is continuous and not confined to those specific times and locations that are really hard to get people to. And I also want to point out there was a study in 2018 that revealed when interactivity is included in microlearning modules, it actually increased the learner engagement by 50%, even when compared to traditional learning methods. Our traditional learning methods are typically like classroom time, long seminars, maybe really long webinars that last an hour. And when we have higher engagement with material, it's going to typically translate to better learning outcomes. And you're going to hear the term just-in-time learning. That means that this is an avenue to allow you to push out immediate access to critical information when it's needed most. And this is really valuable in healthcare settings where we know that timely knowledge directly impacts patient care. So you're going to be able to ensure that your learners are up to date with the latest guidelines or requirements. And I really want to point out increased confidence. Because when we feel more confident in our knowledge and skills, that confidence translates to better decision making, and that translates to better patient care. All right, cognitive benefits. There are quite a few, and you've heard me mention some of them, but I really want to take time to go a little deeper with this. The short focused module that you see with microlearning helps improve information retention because we're only concentrating on one topic at a time. This approach is going to reduce that cognitive overload because we're breaking down that complex information into more manageable chunks. And that's what makes it easier for learners to process and then understand the material without feeling overwhelmed. It's when we take away that feeling of being overwhelmed that we're able to enhance memory retention. And we know learners who engage with microlearning content are going to retain 20% more information compared to those who use traditional learning methods. So your participants are going to be more likely to remember and apply the knowledge they gained from microlearning modules. I like to say, think about it this way. Instead of trying to figure out when to host or attend a lengthy seminar, you just complete a series of short, focused modules. Maybe a new topic could be sent out once a week. And that is a spaced out approach, and it's going to allow you to absorb the information more effectively. And as an educator, you've just reduced the risk for cognitive fatigue. And the reason that I want to point out a time frame is because microlearning provides you the means to space out the topics. If you haven't heard of spaced repetition, I really encourage you to check it out because it is a learning technique where information is shared at increasing intervals to really help with reinforcing learning and transferring knowledge from your short-term memory to your long-term memory. Spaced repetition has been shown to actually improve our long-term retention by up to 50% because we are continuously being touched by that information. When you're continually revisiting a concept, that's where you start to solidify the understanding, and then you're more easily and quickly able to recall the information when you need it. Now, we do have research on microlearning comparing it to traditional CE methods. Our traditional CE methods typically are seminars, workshop, courses, and that's going to be really difficult for busy professionals to attend. And these methods may also lead to information overload and lower retention rates, okay? So microlearning has been shown, as I said earlier, to increase engagement by 50% and retention rates by 20% compared to your traditional CE methods. And what that tells us is that microlearning is more effective in keeping learners engaged and helping them retain information. It's also been found that microlearning modules that use interactivity, they increase learner engagement. More engagement with your material is typically going to translate to better knowledge retention and application. Now, microlearning also opens an avenue for you to push out critical information when you need it the most. And there was a study published in 2019 that showed a 30% improvement in clinical decision-making when microlearning was used for just in-time updates. You're also going to see higher completion rates and typically quicker completion because of the shortened length of time it takes to complete it, but also that flexibility that you're giving them by using mobile devices. The content is going to fit into their busy schedule. It's going to fit into your busy schedule easier than trying to schedule or attend these classroom seminars or even sitting down to try to listen to a webinar. Now, when it comes to deciding on a microlearning platform, you're going to need to look at a couple of different features. That platform should have an intuitive and easy to navigate interface. That user-friendly design is going to ensure that your professionals are going to be able to quickly access and complete modules without technical difficulties. Now, the global mobile learning, that's a mouthful, global mobile learning market, it was projected, the size of it was projected to reach about $230.12 billion by 2029. Now, between that forecast period of 2024 to 2029, that's a compound annual growth rate of almost 25%. This growth that we're seeing in the mobile learning market is driven by that increasing demand for flexibility and accessible learning solutions. And a lot of this was brought about through the pandemic when we started needing more flexibility and accessibility. You're also going to want to have interactive elements like quizzes, case studies, scenario-based activities. You want to engage your learner so that you can reinforce the material. Now, you are starting to hear a little bit more about personalization and adaptability. And these are personalized learning paths that are going to adapt to your individual learner needs. This is going to ensure that each healthcare professional receives the most relevant and impactful content that they need. And this is a really big field right now that is growing due to artificial intelligence. Now, if you are the educator or the administrator, you're really going to want some robust analytics and reporting features. You're going to want to track learner progress, completion rates, and performance, because these insights really help you as an educator and administrator evaluate the effectiveness of the microlearning programs. And it's also, I'll talk about it on the next slide, important for accreditation and regulatory requirements. And lastly, you really want to make sure that whatever platform you use for microlearning is going to integrate seamlessly with your existing learning management systems. Or if you're a facility that has clinical decision support systems, because you can't have both, you want to make sure that this integration of microlearning is part of a cohesive learning ecosystem. It's also really nice if the platform allows for a single sign-on. So not only is it integrating all together, they only have to sign on one time with your hospital's LMS to track their own CE compliance and progress. Right, accreditation and regulatory requirements. It's really crucial to consider accreditation and regulatory requirements when you are looking for a platform. You're going to need to make sure that what you use is going to be relevant to the accrediting bodies and the regulatory bodies that affect your facility. That could be Accreditation Council for Continuing Medical Education, ACCME, or ANCC. If you're for nursing, you probably have both. But you also need to think about state boards as well. And I know I can speak for nursing, and the last time that I checked, there were still 3 state boards that did not accept any continuing education under 1 hour, and they defined that as 60 minutes. So how can you ensure that your staff in these situations are going to get the credit for the time they spend doing continuing education that your facility requires? Could you do a 60-minute curriculum over like maybe 6 10-minute micro learnings that you push out over a month or 2? Or will your platform allow for the certificate to be provided at the end? Now, if your organization aligns with Centers for Medicare and Medicaid or Joint Commission, you also want to think about them as well. And you want to make sure that you have a continuous improvement practice to help maintain high standards of education. You should be regularly updating your curriculums for the latest research finding, clinical guidelines, and from feedback from learners. All right, what can I assess? So some of the things that you can assess, because sometimes when we're in healthcare, we think, oh, I can't assess those things, but you have a lot of options and a lot of choices depending on the platform that you go with. Multiple choice questions, flashcards, scenario-based questions, interactive case studies. You can do all those to really help assess understanding of medical conditions, treatment protocols, and guidelines. There's video demonstrations that could be followed by practical assessments or interactive simulations to evaluate proficiency in performing clinical procedures like wound care, catheter insertion, and CPR. Interactive case scenarios where you have learners make diagnostic decisions based on presented data can help with testing the ability to interpret lab results, imaging studies, and patient symptoms. So you really have a lot of assessment options, and because there's still more, there's role-playing scenarios, complex case studies, problem-solving exercises, interactive decision trees, branching scenarios, interactive tutorials. As I said earlier, it's really only limited to your creativity and the platform, the capability of the platform that you use. We do have some challenges and some considerations to think about. And the biggest one is really making sure that your content is accurate and up to date. So you really have to stay on top of the education that you create and reuse to make sure what you're disseminating is not outdated. Now, microlearning is designed to be brief and focused, and so sometimes that can lead to a lack of depth in content, and striking that right balance between providing comprehensive information and keeping modules short can be challenging. So you want to use a modular approach where your complex topics are broken down into a series of interconnected modules, each focusing on a specific aspect. And that will allow for more depth without overwhelming your learner. And that's really good for the in-depth topics, say like diabetes management, but it's also going to require a lot of planning on your end to make sure everything is met. Microlearning can improve retention and engagement, but measuring its long-term impact on outcomes can be difficult. So you're going to have to assess whether the knowledge gains translates into improved clinical practice and patient care. And this could involve using tracking like clinical performance indicators, patient outcomes, and ongoing assessments to measure the sustained impact of microlearning. And a quick example would be like a hospital who maybe saw a rise in hospital-acquired infections. So they create a module on hand hygiene practices. And while initial assessments may show improved knowledge, it's going to be crucial for them to measure whether this actually led to a sustained reduction in hospital-acquired infections. Now, you do have a lot to choose from. Hopefully you can see that slide. A lot to choose from as far as platforms. There are a lot of types and bells and whistles that you can have to design what it is that you're looking for. I'm not going to endorse any platforms or for a couple of different reasons. They each have their own strengths and weaknesses, and these are going to be defined according to your needs and how much you want those elements for your company. So a couple of big things I want to point out are the main types. You have mobile first platforms, and these are platforms designed primarily for mobile devices, and they are more for allowing learners to access content on the go. And then you have LMS integrated platforms that were created specifically for integrating into your existing LMSs. But that doesn't mean that the other types of platforms are not going to be able to integrate into some LMSs or be able to integrate with a mobile device. It really just means that that was their main focus or is their main focus, but sometimes the companies evolve over time. Other types of platforms and elements that you're going to be able to see are going to adaptive learning, like I said earlier, is becoming really popular because of the use of artificial intelligence and machine learning, specifically to create personalized learning paths. Gamified learning is also very popular. It has a more like you're playing a game, so it's got points and badges and leaderboards to help with really engaging your learners and making that experience more enjoyable. You do have something as simple as card-based learning, where you literally just have digital note cards that people use. And then you also have content library platforms. And I want to point out there are platforms that have already built vast libraries, and maybe you can use those, but you really want to make sure that if they don't have what you need, then what can they create what you need, or can you create what they don't have? So you have a lot of types and elements to choose from when selecting a micro-learning platform. Now, which micro-learning platform works best for your company? This list is really just a list of questions that go back to what we've covered throughout this presentation. These questions are really a good starting point for you to start asking questions, but by no means is this list an all-inclusive list of questions. You're really going to need to analyze your organization to determine the specific needs and desires of your staff and your education department to identify what other questions do I need to ask. Feel free to take a screenshot of the slide to keep for reference. I know that we're short on time, but something else that I really want to point out that I've had happen multiple times is when you are working with a company, trying them out, you're test driving them. I really recommend test driving the company to see, are we going to be good partners? You want to make sure, usually they're going to give you their platinum version to check out, and you're going to start to love that platinum version. And then when you start talking about buying it, somehow at the end of it, you end up with the basic. And then it doesn't do all the things that you got used to it doing, and you're not able to do the things that you need to do. So make sure that you are, if you're using the platinum and those are the items you want, make sure you have a good conversation with that company before you pull the trigger. And the last thing I want to point out really quick is some future trends. We do see some fun future trends coming our way. Integration with smartwatches and fitness trackers, artificial intelligence, that market is really growing. There's a lot of things coming out of artificial intelligence that we're going to be able to use to really personalize learning paths. So I'm excited about that. Gamification is also becoming really popular and really growing. They can motivate and engage your learners, especially our younger generations who grew up with a lot more of this in their learning. And then AR and VR technologies, those are really booming as well. And then something new that's kind of coming up is social learning platforms that allow people to collaborate and share knowledge and learn from each other. And this approach is really all about fostering a sense of community and encourages continuous learning. So there's a question here. It says, what criteria should be used to determine which issues or topics are most effectively delivered through microlearning? You can deliver a lot of education through microlearning. I will say there are things that you have to test over. Like if you have to be hands-on, it really shouldn't be microlearning. But what you can do is you can share the things that you would have taught in a classroom. You can actually transfer those into smaller modules, and you can send those out. One of the things that I will say is, as an educator, don't forget to be a face to the people that you're teaching throughout the hospital. All learning should not necessarily be microlearning. If I had to choose, I would say the things that I need to push out quickly and the things that I don't need to see them for could be pushed out as microlearning. But a lot of times those push notifications that when we're pushing them out to people's phones, they can become like white noise, and then you're going to see lower engagement. So some of the things I would say to do is talk to the people that you're teaching. What do they want? I've walked around with a syllabus and asked students what they wanted, and they actually wanted things that I didn't think they wanted anymore. Did you want a test for your final? And they wanted a test for their final, just as an example. So I would say I would start small with a few things. I would talk to my staff and see, do they like this? Are they learning from this? And I would also figure out where is it most helpful for me as an educator to use it. And if I had to choose, I would say it's those quick, just-in-time things that I would for sure use microlearning for. Any IMs that's good for learning pathways and or stacking or packaging microlearning, learning management systems. Most of your microlearning platforms have gotten to where they can actually integrate into your learning management systems. So honestly, what I would do is start with my learning management system, and I would ask them, hey, what microlearning platforms work really well with your company? Or if you already have a microlearning platform, I would talk to the microlearning platform and say, hey, what learning management systems really feed well into your platform? So, like I said, I really don't want to identify and point out specific ones because every facility has its own needs and every platform, even our LMSs, have their own weaknesses and their own strengths. So it's really going to be all about basically dating those companies and figuring out which ones have the things I need for my facility and which ones work together. So I know this is a quick 25 minutes and there's so much more that I would love to have shared with you. So I do want to leave my slide really quick. This is my personal email. This is my LinkedIn. This is where you can find me. If you have any questions, please feel free to send those to me. If you want the slide deck, anything like that, just please feel free to reach out to me. And it was a pleasure to be here today.